this video, we will discuss about the axilla or armpit. It is basically pyramid-shaped space between the upper part of arm and side of chest. Axilla has two ends, the upper end and the lower end. Upper end of axilla is known as apex and lower end of axilla is known as base. The upper end, the apex, is directed into the root of the neck. The front of the apex is covered by the clavicle. The posterior side of apex is covered by the upper border of scapula, and on the medial side there is outer border of the first rib. The lower end, the base, is covered on the front side with the anterior axillary fold, and on the back side there is a posterior axillary fold. Anterior axillary fold is formed by lower border of the pec major muscle, whereas the posterior axillary fold is formed by the tendon of latissimus dorsi and teres major muscle. The medial side of the base is covered by the chest wall. Next, we will discuss about the walls of axilla. There are basically four walls of axilla: anterior, posterior, medial, and lateral. Anterior wall is made of three muscles. We can memorize it by mnemonics PPS, pec major muscle, pec minor muscle, and subclavius. Posterior wall is also made of three muscles. We can memorize it by TLS mnemonics, that is teres major muscle, latissimus dorsi, and subscapularis. Medial wall is covered by upper 4 and 5 ribs along with intercostal spaces covered by serratus anterior muscle, whereas the lateral wall is formed by coracobrachialis and bicep muscle. Now we will discuss about the key muscle of axilla, that is pec minor muscle. Pec minor muscle is basically thin triangular muscle that lies beneath the pec major muscle. The origin of pec minor muscle is from 3rd, 4th, and 5th rib. It runs upward and laterally, and insertion is on apex into the coracoid process of scapula. It crosses the axillary artery and the brachial plexus of nerve. The second important thing is clavipectoral fascia. That is a strong sheet of connective tissue that is attached above clavicle. The content of axilla include axillary artery and its branches that supply blood, axillary vein that drain blood, lymph vessels, lymph nodes, important nerve plexus that is brachial plexus. This all content is embedded in fat.